adults are affected in New Zealand. Maori and Pacifica ethnicity have a similar prevalence but more severe disease. Maori people and Pacific Islanders are more affected by sunburn. Specific factor, New Zealand has high UV index and outdoor activities, so it increases the risk of sunburn. And another is the country's unique climate and environmental condition also increase the mild eczema in New Zealand. Mild eczema, I already mentioned all of you, it is the atopic dermatitis, and the pathophysiology of mild eczema involves the complex series of biological process and mechanisms that are immune dysregulations. In individual with eczema, there is an overactive immune response to certain triggers such as allergens or irritants, allergens from dust materials like pollen from plants and other irritants from detergent or soap. The immune dysregulations leads to chronic inflammation in the skin. Skin barrier dysfunction. The skin barrier, which is composed of lipids and proteins, plays a crucial role in maintaining skin hydration and protecting against external irritants. In individuals with eczema, there is a defect in the skin barrier, allowing irritants to penetrate the skin and trigger an inflammatory response. Each scratch cycle, the itching associated with eczema can lead to scratching, which further damages the skin barrier and aggravates inflammation. This creates a cycle of itching and scratching that can be difficult to break. Genetic predispositions, there is a genetic component to eczema with certain gene mutation increasing the risk of developing the condition. However, environmental factor also plays a role in triggering and aggravating eczema symptoms. Risk factor is exposure to sunlight. Excessive exposure to sunlight, especially without proper protection such as sunscreen or protecting clothing, increase the risk of both sunburn and eczema. Genetic susceptibility. Certain individuals may have genetic predispositions to sunburn and mild eczema, making them more susceptible to these conditions even with minimal exposure to the sunlight. Medicines or treatment option, moisturizing cream. Moisturizing creams helps to reduce the dryness and itching associated with mild eczema, providing a temporary relief. Some moisturizer used in New Zealand are ceramide, CeraVe, lactocalamine, or aloe vera gel. Sunscreen. Sunscreen is highly effective in preventing sunburn by blocking harmful UV rays from penetrating the skin. Sunscreen used in New Zealand are Cancer Society 50 SPF, Dermaven 50 SPF, Natural Clear Zinc. Medicines, which if the patients have painful conditions and inflammations or chronic eczema problem, paracetamol, ibuprofen, and diclofenac can prescribe. These medicines has analgesic and anti-inflammatory properties, which helps to reduce the pain and inflammation. Corticosteroids cream, they come in different strength from mild to stronger. Prescription medicines, for example, hydrocortisone 0.5%, which is available in over-the-counter drug. If we need more strength, we should go through prescription. Applying a cold compress for burn is very necessary. Stay out of sun during peak hour. Wear covering cloth, wide brimmed hat, and sunglasses during outdoor activities. That's it.
What should I put? PhD 1.1.
That's it.
And the most common moisturizer in New Zealand available easily in
Most
pharmacy?
common moisturizer. CeraVe, ceramide, like aloe vera gel.
Sorbolin.
Sorbolin.
That's the most common, so you can buy over the counter.
Okay. Then other.
How long is the duration of the SPF?
Every 2 hours we have to apply.
Have you shown the references?
Yeah.